What's going on, everyone? Welcome back to another episode of Gut Check Radio. It's your host, Dr. Nick here. And if you're listening to this shortly after it's been released, then it is probably sometime between Christmas and New Year. And I wish you and each and every one of you and your family members a Merry Christmas, Happy Holidays, whichever season or holiday that you decide to celebrate it. May you allow lots of joy and lots of gratitude and lots of just time for love and appreciation for the life and the gift of life that we've been given. Anyways, this morning I was reflecting on something, and that is introducing a stress or introducing something into your life after it hasn't been a normal part of your routine or hasn't even been in your routine for a little bit. And how sometimes if you introduce something that's previously wasn't new, but is new to your body, you might get some new outputs. As I like to tell a lot of the patients I work with, sometimes if we give a new input, we want a new output. Sometimes we want that. If you've been doing the same thing over and over again and you're expecting a different output to happen, I mean, that's insanity. So sometimes you give a different input in order to elicit a different output from how your body feels. How did that actually manifest in me this morning? So over the past 2 weeks, I've probably only had coffee once or twice. I did my usual once a week off every 4 to 6 weeks. And if you want to listen or care to know why I do that, I talked about that in a previous podcast episode about how to ditch your dependence on caffeine. So I did that. And also I was feeling a little bit under the weather the following week. So my thing is because caffeine is a stimulant. When I'm feeling under the weather, I'm trying to really set my body up for mostly in recovery mode. So I tend to avoid stimulants or things like that. So I was just having tea and caffeine-free tea instead of caffeine. Throat Coat, huge fan of Throat Coat. Not to shout out any brands or anything. And then, so I haven't really had that caffeine consumption that much in the past 2 weeks. So my system, my body is really sensitized, meaning when I introduce caffeine, I'm probably going to feel it pretty well. So what I did this morning was I had time for coffee and feeling pretty good. I'm like, hey, I want to have some coffee. It's one of the great spiritual loves in my life. And I introduced it. But I think what I did is I introduced the amount of caffeine that I typically would have had 3 weeks ago when I was sort of at my peak consumption levels, which for me is anywhere around 150 to 200 milligrams. Anything above that, I start to get a lot of the negative effects of caffeine, jitteriness, shakies, inability to focus, which at a lower dosage for me is the perfect sweet spot. And I should have known that. I should have known that I shouldn't go right back to the level I was consuming because my body is really sensitized to it. So what I did is I went back and consumed. And for those of you, 150 to 200 milligrams is most pre-workouts or energy drinks are going to have at least 200 milligrams. Your average cup of coffee is going to have anywhere between, 100 to 150. Your average espresso shot is going to have around 75 milligrams, plus or minus a few. So I introduced probably a little too much. And as typically it goes when I do this, is I feel really good for the first 30 minutes, when the caffeine is reaching its peak blood levels in your brain and your blood, and you feel alert and like you can tackle anything and you have thinking of all these great ideas. And then about an hour later, started feeling kind of shaky, kind of jittery, and really cold. And it's starting to get cold, in air quotes, here in Arizona, relatively. So there's already a bit of a heightened sensitivity to the temperature changes. And I noticed that I was shivering. And I actually am someone who likes being cold, but I like it when it's cold outside. I really don't like when my body temperature feels like it's decreased or when it feels like I'm shivering pretty high, or when I'm shivering pretty voraciously internally. And what you come to find out is part of what caffeine does is it's actually what's called a vasoconstrictor. So it cuts off blood flow, which is actually part of the reason you feel so alert in the brain is because it does some weird things, but it also cuts off blood flow to your fingers and toes. And our fingers and toes are actually where we do our most amount of temperature regulation. So sometimes because of that vasoconstrictive effect, you perceive your external environment as colder, or you actually dissipate more heat because of that vasoconstriction. So your body feels colder internally. Now I was feeling that for about an hour, slightly uncomfortable. So to me, the whole lesson of that, and to lesson for you listening out there, is if you used to give an input into your body and you're used to feeling X, if it's been a while since you've given input X, don't expect to get that same output when you introduce it. Expect something different because it's been a while. So sort of mentally prepare yourself. So if you haven't introduced a food in a while, and as you're heading into the holiday season, you're introducing gluten and dairy or baked goods or added sugars, other things, and it's been a while since you introduced it, expect not to feel the same you did, because you're probably a different person than you were the last time you did it. So thank you all for listening to me on this week's installment of Health Monologue. And now we'll get back to part 6 of the thyroid series.
Welcome to Gut Check Radio, the holistic health podcast where we explore the uniqueness of the human experience to help you navigate your health journey. I'm Nick Belden, a chiropractic physician and functional medicine practitioner. And you all know what's coming next, but the information provided in this podcast is for educational and entertainment purposes only and is not intended to diagnose, cure, or treat any disease, and do not apply any of the information here without first speaking with your physician.
All right, welcome back, everyone, to part 6 of the thyroid series. I hope you've been enjoying this. I hope you've derived some sort of either information or even entertainment. I know I'm not that funny, but maybe you've chuckled once or two at, wow, this guy really doesn't know that much. And you'd be right in that assertion about all things thyroid health. Talked about food, talked about sleep, talked about testing. We haven't really talked much about hormone replacement, because I'm not a prescribing physician, and it's not a topic I have a lot of direct expertise on, especially in regards to what dosage and how much and things like that. But what I do know, and from I've working with enough people, is that it's very, very common for people to find their labs low thyroid hormone, autoimmunity, and their physician puts them on hormone replacement, whether it's levothyroxine, NP thyroid, Nature-Throid, Armour, Synthroid, etc. And people hope and expect to feel better, more energy, more regular bowel movements, better mental clarity, better skin, etc. And they might for a little bit, but eventually they go back to where they were feeling, or they feel the exact same regardless of having been on hormone replacement. And you're really sitting there wondering, hey, if my levels were low, if that's what the lab says, is the lab that accurate? And we talked about that in the first installment of the series. And if so, if I'm low in hormone and I give hormone, I should feel better, right? Sort of what is the deal that's going on here? And I experienced this enough in practice to really start to ask myself that question. If it's just as simple as the lab says it's low and you give hormone and it doesn't help, what's going on there? So that led me to deduce, tip 6 here in the thyroid series is 3 reasons hormone replacement isn't working for you. Again, I am not a prescribing physician. Do not stop or alter any of your medication without first speaking with him. But this is just my best guess and my interpretation from what I've seen and my understanding of the literature and the science about why it is that you would have been put on hormone replacement therapy and felt no different. I've talked with quite a many physicians out there, some of which who are prescribing thyroid hormone replacement, and they always talked about optimal levels with their patients, that they're always getting labs very frequently, maybe every 2 to 3 months, to try and get their T4, their T3, their free T4, free T3, or maybe total, or even reverse, if that's still part of the practice of any physicians out there, is they're trying to get it at a specific level because they say, hey, when my patients have their levels at this number, this is when they feel the best. I totally understand why they would do that. But in our experience, we really want to focus on treating you, the individual, and not just your labs. Your labs are not 100% absolute truth. To me, how you feel is more truth than what your labs say, especially as an adult. And kids, sometimes it's a little different because they don't even fully comprehend the idea of truth. But in an adult, you know what your truth is. So the idea of saying, as the slide goes with, for those of you listening on a podcast, is, your levels are low. This is what a physician might say. So you need hormone replacement and everything will be great. And I used to be someone who used to think that, but more in the more natural, holistic approach where, hey, if someone's hormone labs came back low, let's give some herb, let's give some vitamin and mineral cocktail. It's going to help their body produce that optimal amount for them. And if that works, kumbaya, fantastic, then this probably isn't the episode for you. But if you're listening to this, I imagine you either are just genuinely interested in thyroid, or this has affected someone you know, or more importantly, it's affected you. You've been put on thyroid hormone replacement, wondering why in gosh darn it hasn't fully helped you out. And this is sort of what I want the hope of this video to help you answer. Reason number 1 is not absorbing the amount of hormone that you're taking, or not absorbing what you're taking. And on this slide here is a picture of what's called the microvilli of the small intestine. And it's these little hair-like structures. So if you can think of, a lot of us have these sort of carpet mats in our bathroom that sort of look like these little hair-like projections. They look like little cylinders that are sort of sticking up. And that's sort of what our small intestine looks like. And that's called our microvilli. Micro meaning small, villi meaning the nature of its structure. And that's where we absorb most of our vitamins and minerals. Most of our vitamins and minerals are absorbed within the small intestine. That's why we've talked so much on this podcast about the health and the function of the small intestine. And thyroid hormone replacement, whether it's, again, T4, T3, or a combination of the two, gets absorbed in the first part of that small intestine within this microvilli. So if we know that it gets absorbed within the first part of that microvilli, it stands to reason that if you have some sort of condition, call it inflammation, call it dysfunction, or an imbalance in that small intestine, it's plausible that you might not be fully absorbing what you're taking despite taking the recommended dosage. And that's why your practitioner might be recommending you progressively increase your dose. Maybe you started off at 60 micrograms and now, or milligrams, and now you're at 100, then you go 150, and it isn't until 200 that you start to feel something. There's a possibility that that is because there's so much inflammation and dysfunction going on in your microvilli of your small intestine that you just need that much more to absorb it. 100 milligrams, you're absorbing maybe only 5% of it. So if you double it from 100 to 200, you've now doubled the amount you've absorbed, and potentially you're feeling better, which is a completely reasonable approach. But what's even stands to reason more is, why is it that there's inflammation or things going on within the small intestine? And there's a number of reasons that could be contributing to that. Could have lactose intolerance. Lactose is the enzyme that's present within the small intestine that helps us to degrade a lot of the lactose milk sugar. And because it's present within the small intestine, specifically within that microvilli, if there's inflammation there, you could damage the literal house where these enzymes live. So you just, not as many houses, not as many people. So it might not be as many enzymes. Number 2 is an H. pylori infection. H. pylori was a bacteria that was discovered in the late 1900s, about 1980, 1990s, to be one of the number one cause of stomach ulcers. And so it does its most amount of work, I'll say, in the stomach, but can also be an involved agent in the small intestine, which can in and of itself, again, be contributing to damage within the small intestine. Number 3 is a condition called autoimmune gastritis. Now, we've talked previously on this podcast about autoimmunity. I don't love the phrase that it's the immune system wrongly attacking itself. I think the body is perfectly designed, and it's innate wisdom and its intelligence. So nothing is happening for wrong reasons. It's happening because of a certain input you've been giving your body. So it's giving you an output based on the inputs, as we've talked about in the intro. But gastritis, anytime you see something in an itis, it just means inflammation. So essentially inflammation of the stomach. And it's a theory that there's an autoimmune process. Your immune system is mounting a response within the stomach that could be affecting the pH of the stomach, which has a huge implications for all things protein and especially vitamin mineral absorption and digestion. So if that's going on, that could be something that could be affecting your hormone replacement absorption. And the last two, to me, are probably really the most important. Number 4 is celiac disease. We know celiac disease itself, an autoimmune condition, is actually where the immune system directly targets those microvilli. So it is directly affecting the place where thyroid hormone gets absorbed. Now, things like H. pylori and gastritis more so affect the upstream process of things happening within the stomach. But celiac disease, the hallmark of it is literally the microvilli of the small intestine. That's why if you have celiac, you've had a biopsy of your small intestine to see how much damage, I don't even love the word damage, to see how much stress has been caused to the microvilli. And lastly, inflammatory bowel disease. So that's Crohn's and ulcerative colitis. Each one have their own little nuances. From my experience, Crohn's tends to be one that affects more of the small intestine. And ulcerative colitis literally meaning inflammation of the colon. So we're talking large intestine there. And Crohn's seems to be more confined to the large intestine. So if there's any damage or inflammation going on via Crohn's or via that same sort of autoimmune type process, in this instance, some people theorize it could be the immune system responding to the microbes rather than the microvilli. But because the microbes live in such close, they live right on top of those hair-like projections. You have the microbes on top and the microvilli below. If there's inflammation and stress happening to the microbiome, it's probably also happening to the microvilli. So you have all these conditions, all these scenarios, all these stressors that could really be impacting your ability to absorb thyroid hormone. So it stands to reason, if you have to keep increasing your dose to feel a similar or any effect, the root cause probably isn't a lack of hormone. The root cause is probably one of these GI conditions, which, to even go a layer deeper, what is the root cause of that? Imbalances within your nutritional and lifestyle practice. Reason number 2 is not addressing the gut microbiome. And for those of you watching on YouTube, you see this little video here of these little spherical and cylindrical type objects, likely microbes just floating around. And if you've actually looked, I don't know why any of you out there would do this except me, if you've looked at any microscopic images of stomach or gut bacteria, it's actually quite fascinating. Again, there's trillions of them. So you need really high resolution cameras and microscopes to be able to actually see the big picture of the environment in there because it's so small. That's why it's called the microbiome, crazy enough. And I addressed this related to inflammatory bowel disease, meaning that some people theorize it might be your immune system targeting your own microbiome to induce inflammatory changes. So if you're not addressing gut bugs, which could be at the root of any one of those gut conditions, then again, you're fighting an uphill battle by just progressively increasing your dose. And what does the gut microbiome consist of? If you're new to this podcast, it's the trillions of microorganisms that could be anything, mostly bacteria, but there's also some viruses, there's also some funguses, there's also some protozoa or some various worms that are actually perfectly normal to be in your gut. I know some people go on worm or parasite cleanses and they feel like they see these parasitic worm-like things come out of their gut. And while I am inclined to believe people, from my understanding, a lot of that could actually be the stomach lining because we shed the stomach lining every 3 days. So you do a 3 to 7 day detox. Odds are, and it's involving probably not a lot of solid food, a lot of liquid, a lot of tinctures, a lot of herbs. Likewise, you're more likely to see these mucus worm-like things that's actually your own mucus lining rather than an actual worm. But anyways, that's my quick soapbox. So not addressing gut bugs could be the second reason why you're having trouble absorbing the amount of thyroid replacement hormone that you're taking. And what can contribute to that? Really, at the 30,000 foot view, to me, it comes down to an imbalance. Let me move my picture out of the way. An imbalance between beneficial microbes and not so beneficial microbes. And for those of you listening on the podcast, I have a sort of teeter-totter here where to one side, the side that is heavily weighted, side that is on the ground, is the not so beneficial microbes. Some people call them pathogenic. There's also the category of opportunistic, which we don't need to get into. And the other side is beneficial microbes. So essentially you have more non-beneficial microbes than the body is used to. And so really the goal in a lot of gut conditions that have the microbiome at its core, whether it's inflammatory bowel disease, even IBS, SIBO, gastritis, lactose intolerance, even celiac disease, a lot of it comes down to how do we rebalance things going on within the microbiome. That's the most fundamental view. And we're going to talk about some basic nutritional and lifestyle behaviors you can incorporate to restore the balance within the microbiome. The goal here is how do we get balance back? Because if you restore balance, then you restore the created order, the harmony, the wisdom that already existed within the body that allowed you to have great health and good function. What things do that? I'm going to give you all three tips, because for me to just sit here and list off 30 things as I used to do, not very helpful, but I'm going to give you 3 things that I've seen work really well for my patient base. 3 really basic things to help restore, reshift the balance to what was the creative balance within your microbiome. And number 1, be conscious of your antibiotic use. What do I mean by that? I think it's very common. Antibiotics are one of the marvel creations of our time. I mean, I think there are a lot of people in the natural holistic space who poo-poo them entirely, but I think there's a use case for them. Case in point, last week I had a patient really, really health conscious who were going through his history, and he told me previously that he developed a MRSA infection, which is methicillin resistant Staphylococcus aureus, which means this bacteria is literally resistant to antibiotics because of the frequency at which we use antibiotics. And ironically enough, one of the best things you do for that is you give antibiotics. So he needed IV antibiotics in order to save his leg. So there is a time and place to use antibiotics. But the fact that bacteria have adapted to these antibiotics tells you how ubiquitous they are and how overprescribed and how overused they are. So just be conscious of them. So I would always ask, if you've ever been prescribed or if you're ever being recommended antibiotics, maybe ask the doctor, hey, is there too many times I can take antibiotics in a particular time period, whether it be a year, 6 months, 2 years, 5 years, really, really ask questions on, hey, do I need to be taking these as frequently as I am for upper respiratory tract infections or colds that might be viral, that might just go away on their own, or a strep throat? If you have it once in a blue moon, I can see how it would be less harmful to the microbiome. But if you keep needing to be prescribed antibiotics, you should ask why you keep needing them and ultimately get to the cause of why your immune system is having the struggles it is fighting off these various organisms. So just begin to be conscious of your antibiotic use. From my clinical experience, again, don't stop taking them without first speaking with your physician. I am not a prescribing physician of antibiotics. From my experience, once people start to have to be on them 3 to 4 or more times a year is when you really start to see lasting effects on the gut microbiome. Like the patient I had last week, he took him 5 years ago for the MRSA infection, hasn't had to take him since. I'm not worried about the long-term effects it's had on his microbiome taking them one time. But again, 3 to 4 times a year, there's some consistency of the microbiome being exposed to them. Could be something to be conscious of. Number 2 is to get outside for 20 minutes a day. Everyone knows that. Most of you listening right here know you need to get outside. But I'm going to give you a little bit more insight into why it might be beneficial for your microbiome. We all know a friend, a family member who grew up on a farm, was exposed to many different kinds of farm animals, to farm environments, to farm air, to different grasses, to different dirts. They were just outside all the time. And they don't have any allergies. They have great skin. They can seemingly eat whatever the heck they want because they said they grew up eating fuzzy hot dogs and moldy bread. So they were always milking cows or doing what have you. And so to me, that was just a proxy of being outside and having their immune system exposed to tiny amounts of microbes in order to train it to not be overly reactive, in order to train their gut microbiome to be incredibly resilient. So even in today's environment, getting outside for 20 minutes a day is more than just sunshine. It's more than just vitamin D. Sunlight has far more effects than just vitamin D. But being in the natural air, breathing in the byproducts of some of these microbes that for the most part are beneficial depending on where you are, allows your own microbiome to be exposed to different microbes outside of probiotic fermented foods to be able to build up the reserves we talked about in a prior episode. The stress cup, being outside increases the size of your stress tolerance cup by exposing your microbes to different things. So that would be my second most prominent tip to harbor balance within your microbiome, is to get outside. Number 3 on the nutritional front is to eat more than 30 different kinds of fibrous foods in a week. What do I mean by that? I've talked about this one ad nauseum as well in this podcast, but it keeps needing to be harbored because time and time again, when I have my patients, when they first sign on for us, when I have them track their nutritional diversity, only once have I seen someone over 30. Most of us lie anywhere between 11 to 20, which is fine. And if you actually look at most Americans, I think they eat the same 10 foods per week, think about most people, they're probably getting the same stuff from the grocery store each month. So, and I've talked about a previous podcast, ways you can increase your nutritional diversity, practical tips and strategies. So if you're looking for those, I would go back and listen to that. But that is such a prominent tool. Diversity of food intake leads to diversity of microbiome, which will lead to harmony, balance, the restoration of the created order that is your gut microbiome. All right, the third reason that you might be needing to take more thyroid hormone replacement, or the amount you're taking isn't helping, or you started it, helped a little bit, and then it stopped, or it didn't even help at all, is you haven't addressed autoimmunity. We've talked about this in tip 1 when we talked about running thyroid antibodies. The reason this makes sense to me is the number one cause of low thyroid is attributed to autoimmunity. So if you're on thyroid hormone replacement and no one's ran TPO antibodies on you before, I think that's a disjustice to you. Because if it's a number one cause, upwards of 90% of all hypothyroid cases or low thyroid are attributed to autoimmunity. If it's the number one cause and it hasn't even been run, to me, that's, I don't want to say malpractice, but it's getting darn close. So if you haven't addressed autoimmunity, if you haven't worked to uncover the root stressors or the root causes, a lot of people in functional medicine talk about the root cause of autoimmunity is gluten, it's heavy metals, it's toxins, it's this. I'll be honest with you, in my theory, I think that's too simplistic. I think we still don't know enough about autoimmunity, and we're slowly learning more, but I think we still don't know enough to definitively say it's caused by this, it's caused by this, it's caused by glyphosate. Sure, is it contributing to it? I'm not going to say no. But I think autoimmunity is this big picture where I look at it like stressors. Like, hey, your ability to tolerate those stressors has become too much. And so autoimmunity symptoms, again, just because you have a lab marker that shows autoimmunity does not mean you have autoimmunity. It doesn't take ownership of you. You are your own person, which is something we'll talk about in later tips. But if you haven't addressed why that is there, why that's present, or what imbalance or what root stressors are contributing to it, then I think we should start there. And so I'm going to give you guys 4 root stressors that I think are contributing to autoimmunity. Again, to say one thing causes it, I think is a disjustice. And so here are the 4 common stressors that I believe drive autoimmunity. Number 1 are perceived stressors. And we're going to talk about all 4 of these in a subsequent tip video. We're going to go really, really in depth. But perceived stressors, these could be, to me, this is really what most people think of as stress, perceived stress. So it's something you perceive externally, whether it's someone cut you off in traffic, your boss gave you a weird face, or your spouse left you for whatever reason. All these are perceived stressors that we then internalize into and intermix with our physiology, and then we feel angry, or we feel sad, or we feel stressed. So when most people say, I'm under so much stress, typically it's perceived stress is what they're talking about. That's one big stressor that can drive autoimmunity. You know, we all know people who maybe they feel like their symptoms started after they lost a spouse, lost a loved one, got fired, lost their business, in a car accident. Any sort of trauma really is a dramatic impactor of autoimmunity. And number 2 is glycemic variability. What does that mean? That's blood sugar dysregulation, which from my experience is most attributed to imbalances in protein intake, imbalances in caloric intake, imbalances in certain vitamins and minerals, imbalances in muscle mass, all the above. And again, we'll talk about that one more in a subsequent video. But number 2, again, glycemic variability, or just blood sugar dysregulation. Number 3, circadian disruption. That just means your sleep schedule is thrown off. This is a really, really fancy way of saying that your circadian rhythm, that 24-hour internal biological clock, is being disrupted because of shift work, maybe erratic sleep schedules, maybe you're not getting sunlight at all during the day, maybe you're consuming caffeine way too late in the day. Anything that shifts or dramatically alters or stresses your circadian rhythm, I believe could be a kickstarter to autoimmunity. Number 4 are inflammatory signals. So perceived stress, we know, can kickstart inflammatory events. Blood sugar dysregulation can induce inflammation. Circadian disruption can induce inflammation. So what do I mean by direct inflammatory signals? That could be infections from certain bacteria like H. pylori, like we talked about earlier in this series. That could be from various toxicities you're exposed to in your air. Again, I'm not saying these things aren't the single driver, but they definitely are a source of stress for your thyroid and for your autoimmunity. So whether it's the particulate matter in the air, maybe you're using lots of synthetic fragrances and chemicals and candles or personal care products, or lots of non-stick cookware, that are exposing you to a lot of volatile organic compounds. Maybe there's mold in your home. Maybe you're drinking water that's heavily contaminated with nitrates or chlorogenic compounds or heavy metals like arsenic or cadmium. All these different things that can contribute to inflammatory signals going on in your body. Maybe you eat a diet that's very high calorie, high sugar, low fiber, low protein, which in and of itself is inducing inflammation going on in the gut microbiome. So that's reason number 3. So in a recap, again, I'm going to go into these 4 reasons regarding autoimmunity in the next tip video, but the 3 primary reasons that you should consider if thyroid hormone hasn't made you feel the way you want is: number 1, you're not absorbing what you're taking, address what's going on in the gut. Number 2 is you haven't addressed gut microbes, which heavily impact the environment within the microvilli, within the absorptive capacity. And number 3 is you haven't addressed autoimmunity, which can itself be related to gut microbiome. So again, as I always talk about, I'm a big fan of gut and gut health and gut function. So I think there's lots of ways you can support your thyroid function, support your energy levels, support your bowel movements, your skin, your ability to tolerate cold temperatures, your mental clarity, by addressing the imbalances that could be, again, not saying for everybody, but that could be going on in your gut. And stay tuned for our next tip series, as we're going to talk about these 4 common stressors that I think are most contributing to the autoimmune process.
Like, comment, and subscribe if you care to see me ramble any more than you already did today. And for more free content and guides, you can check out my clinic website at www.hivenaturalhealth, /free-resources. And until next time, my friends, trust in your gut.